FreshPod is created for industry professionals and is intended for educational purposes only. This content is not designed for patients or consumers.
When you're comparing retail products to professional home care, they are chalk and cheese. But people think that they might be similar because there are some key ingredients that get thrown around. So we know things like niacinamide, ascorbic acid, and anybody can have that. Anybody can buy a vat of that somewhere and put that in something. But the key differences between a professional skincare brand is what you'll notice, and I've noticed this with most of them, they've got much higher levels of purity of the actual cosmeceutical ingredients. So sometimes, yes, that is reflected in the price. It is a little bit more expensive, but it's a little bit more expensive because that is genuinely got 15% matrixyl in there, and that's why. But it's also got all of these other ingredients in it as well. The other thing with the professional skincare that it doesn't have is it doesn't have a lot of real nasty ingredients in there. So when you're looking at a professional range, they tend to, I've yet to come across one that has got known endocrine disruptors, that has got known irritants and known carcinogens. And it is appalling the amount of skincare that is sold in a retail space, and I'm talking any of it, supermarket, chemist, all of that has actually got a lot of these filler ingredients in them that we now know, and we've actually known for a very long time, are actually not healthy and they're not good for skin.
Welcome back to FreshPod, the supportive podcast community from Fresh Clinics, created especially for aesthetic nurse practitioners and clinic owners. I'm Loz McGlynn, and as always, privileged to be joined by my co-host, Fresh Clinics co-founder and medical director, Dr. John Delaney. Today, we're diving into an area many injectors tell us they want more clarity on: how to introduce skincare impactfully into their business. Now, if you've ever thought skincare feels like extra work or I don't have time to sell products, this episode is absolutely for you. Our recent Pulse member survey showed that marketing and patient acquisition are the top two business challenges, making up almost 50% of all issues raised by clinic owners. And interestingly, the SOMA 2025 report showed that 4 in 5 clinics already retail skincare, but those who are confident in their skincare approach are 2.3 times more likely to fall into the 25% of revenue brackets. What does this mean? Skincare isn't just a nice to have, it's an opportunity for continued growth. But it's also not just about revenue, it's about patient results. Integrating skincare ensures patients get better outcomes from their injectables, which builds trust and it builds loyalty. That's why we are so excited to be joined by today's passionate and exceptionally phenomenal friend of Fresh, Steph Yalda, who has supported hundreds of clinics in successfully introducing and scaling skincare ranges with confidence. Let's get into it. Steph, we are really excited to have you here talking all things skin. We are at Fresh Life. There is a lot of our skincare partners are here. You have worn many hats when it comes to the skincare space, which I'm sure we will get into. When we talk to a lot of our members, the idea of introducing a skincare range or potentially taking the time to understand on a deeper level the role that skin and skincare plays alongside aesthetic injectable treatments, sometimes it can feel a bit hard, like it's too much to learn or they're busy enough. But in your experience with your many hats, why do you feel that skincare should be an essential part of an aesthetic business versus optional?
Do you guys remember peak maths in like 2018? Right? 2018, 2019.
I'm sure.
Peak maths.
Yeah, JD was well
would have been right into
that. Just for those listening, that's Married at First Sight, right? I am aware of the show, but you'll have to update me on how this relates.
Well, I shall regale you. So there was a period of time there where there were contestants that were on the show, beautiful people, lovely people, and in some humble opinions, you might say perhaps a little overfilled in some aspects. I actually thought the bigger problem was their skin. on that show. So you could see people every night who had been clearly undergoing some cosmetic injectables and not having their skin touched at all. And I tell you, it is a mess. Like it's a mess. You've stopped halfway, And I think what happens is with the injectors, as I've worked alongside injectors for a long time, and the injectors are looking at something different. They're looking at volume and structure. They're looking deeper. But if you bring your eyes back a bit more and you're starting to look at what's on top, there's actually a whole nother little mess going on up here. So you can do your cosmetic injectables and you could do a really good job, you could do a really bad job. But if the skin is also in a state of dysfunction, if you've got some massive barrier problems going on, if you've got pigmentation, inflammation, redness, how is those injectables helping? It's now you've got all of that and your cheeks up here instead of being here.
Yeah.
It's so the way that in my humble opinion, that I see it is that they work together. It's a combination. We have to do both because when someone is coming and spending that time with you and putting themselves in your hands, I feel like you need to be the expert. And if you're not going to be the expert, maybe get someone to come in and work with you that can do that so that you're actually producing the best work that is coming out of your establishment. Is that the best job that you can do just doing some anti-wrinkle on that patient?
We've had conversations in other episodes of this podcast around what is it that we do in these spaces and when we treat patients. And some of the answer has come back around helping people achieve their best self.
Yes.
Helping people to fully feel their best identity. And if you're only one slice of that, you're not able to achieve all that. And of course, it's a holistic, multifaceted solution. Clearly, skin has to be a big part of that. But hearing what you're saying there around, that doesn't mean that the listener to this podcast needs to become an expert, although it's a very interesting topic to explore. But maybe there are other alternatives around getting some assistance in or having an outside partner to support you around that. In your experience, how does that help? How can you best use that? If someone's listening to this and they're saying, geez, that sounds like a lot to learn. I'm a good injector and I know that, but oh God, that's a big topic. How would you approach that in a clinic? How would you help those people?
It's honestly, look, skin is complicated and it does take experience and it does take years, but that's doing more of a full scope of treatments that you're going to be doing. You don't have to go that deep to do a really good job. The best thing that you can do is get a cosmeceutical skincare into your clinic. Just get a good range into your clinic. And you don't have to get the complicated ones. You don't have to get the ones that have got shelves and shelves and shelves of stuff. When I was working at Fresh, there were ranges that we brought in, that we put onto the platform. And the reason that I got those ranges in was specifically because I knew them, I knew they were good, and I knew that any nurse could use it. That was why I got those two. There's two particularly. And I wanted those in there because of that exact reason, John, because you just need to learn some basics. You don't have to learn every single in and out. You just need to learn the basic ingredients, your A, your B, your C, your peptides. What are they? What do they do? And then the other thing is just having a little bit more of an understanding about skincare in the professional sense. Is there's clear differences between retail and professional. They're not the same. Skincare that's bought over the counter is not the same as the skincare professionally that you will purchase from a supplier. They're different. They're not even in the same realm in my mind. And so to bring something in, if you're thinking, look, I do want to do a better job, even for us, when we're doing more complicated skincare treatments, you can't touch them if they're not using cosmeceutical skincare. The skincare gets their skin to a really good state of homeostasis. You're increasing hydration. You are increasing the blood flow in the skin. You are suppressing melanocyte activity. That can all be achieved with a very simple cosmeceutical range in your clinic. So you can do that for people. You can actually give them beautiful skin and really good results just with the skin line.
And often if patients are seeing healthcare practitioners for aesthetic treatments, they are likely purchasing some kind of skincare range. And whether that's in your clinic or somewhere else, whether it's retail or cosmeceutical, there would be some element to that. I think what a barrier that we hear often is that, the patient comes in and sees our health, sees you for an injectable treatment and is spending potentially, upwards of $500 with you in that room. And so then to bring them out and then start talking to them about, hey, do you want to learn more about the skincare? It feels more like salesy versus authentic in the consultation that they're having from an injectable perspective. What would be some advice or tips that you would say work really well when you're trying to fuse the two together?
No, there's two points to that side, the way that I operate with it. And number one is the practitioner needs to believe in it. Like you need to love it. Like you actually need to use it. You need to genuinely have a very solid belief about what it is that you're doing is number one. Like you have to love it, you have to use it, and you have to know it. And then the other part to that, the other side is you never, ever, ever want to drop it on someone at the end. You've got to bring it right to the beginning, and you've got to establish as a practitioner and as this business, what is my concept? What's my concept here? What am I doing? What is it that I'm bringing to people? And then when you're going through your consultation, you have to paint a picture and show people how it is that you work and how it is that all of this works. And so if you just try to drop it at the end and be like, oh, and by the way, I really want to get you onto this vitamin C on a new patient or a patient that you haven't got that relationship for, that isn't really going to go down well, because it does feel like it's for the sake of it. But if you are actually coming to it in a consultation and you're like, right, now, so we actually need to address your skin texture. I want to work on getting your skin nice and smooth and bright and looking really good and just all nice and even color. And then we're going to start addressing some muscle contraction, and then we're going to start addressing some of the volume loss as well. So it's all going to go together. You have to tell them that at the start.
So one of the first questions you ask is, what are you doing for your skin?
Love that question.
Yeah, and then you're setting that tone of, we're a partner in your skin and your aesthetic health. So what in that partnership, what is the patient doing at home? And if their answer is, oh, I don't do anything, that opens up that conversation, right? And so as part of that, as you've asked the patient, what do they do with their skincare? I suppose to your point, if you're using the brand yourself, that it's not sales, it's advocacy, right? Where you're like, I use this, I love this works for me. What then should someone be looking at a very high level when they're trying to select what sort of cosmeceutical brand they might potentially want to stock?
Yeah.
What are some of the shortcuts to knowledge that people can take there?
I think for each individual business owner, you want to know what problem it is that you're trying to solve within your business. So with any type of business growth and any type of commercial, improvement within your business, you need to make a decision, whether it's a device, whether it's a range, whether it's a new product, whether it's a new S4, you have to have the understanding of the need that is filling within your business, because it is all a little bit different with everybody. I think the skincare range is probably one of the things you're not really going to fail on. Like it's okay if you just get that in there, it's going to work. But what I would start doing is this. The first step is actually getting it, using it yourself. You need to try it. And the thing is, and this is what people, I don't think they all know, but the suppliers and the people that are, providing these ranges, they will come and see you. They will come and do a treatment on you. They will arrange for you to use the home care. So start trying things. Start using it on yourself. I would never bring anything into a clinic that I didn't love, I wasn't using on myself, and that was already making me happy, because that's like a really important pillar of the entire process of rolling that out. Because what will happen if you don't have that connection to it, it will just sit on your shelves and it will just gather dust, and it goes into the too hard basket. And even I've been guilty of that. I remember before I was working with a brand, and I remember it sitting there, and the packaging, it's not ghastly, that's probably a bit of a hard word, but it was boring,
Yeah.
it's quite boring packaging. And I kind of poo-pooed it a little bit. And then when I started using it, I was like, oh, okay, no, they just didn't spend money on the packaging.
Yeah.
It's on the product.
Yeah.
How wrong I was.
Yeah.
So it's so important that you're actually using it.
Yeah,
It's that simple.
that authentic excitement that comes through, and people can feel that you're someone who's used it, and it's a real story, and that itself leads people to trust.
And the only way that you're going to be in a situation where you are just feeling really empowered and that you are actually driving this forward is to have that love of it. For me, it's just a non-negotiable. Does it always go down well with patients that are sitting in front of me? No, because TikTok's around now and everybody knows everything about salicylic acid now and everybody knows everything about retinol now. And, I've got people coming in that aren't using active skincare at my clinic now that want CO2. And it's like, oh, dog, that's going to burn your face off. You can't have that. Absolutely not. And go home and use no sunscreen and just wash their face with a bar of soap. That is bad practice. And if they think I'm selling to them, that's fine. Think I'm selling to you then, but I'm doing this for your own good because I'm telling you now, this is not going to go well for you if you do not follow my instructions with this. And one of the biggest instructions, and my girls know it, I know it, we don't touch anybody with active treatments in my clinic unless they are prepped on cosmeceutical skincare. Non-negotiable. Because there's too much UV radiation in this country and you will turn someone into a raisin as quick as that if you don't take care of how their skin is functioning before you come in hot with some really hardcore treatments.
Interesting that you describe the patient's skincare routine again. What are they doing? Are they washing their face with a bar of soap and doing nothing else? It's almost like as doctors and nurses, we learn about taking history, right? You have to take the history. You've got to know the patient's medical history.
Correct.
In the business we're all in, we're treating skin, whether we're treating it deliberately or not. So we need that skin history. What is the patient doing? What's the medications and medication-like treatments that they're doing, and how do they look after their skin, and do they use sun cream, and so on and so on. It seems like that is sort of table stakes for wanting to get people to look better and wanting people to feel better.
Yep.
If you're a Fresh member, don't forget your resource hub has ready-to-use tools, programs, and connections to help you integrate skincare into your patient journey. We partner with some incredible clinical-grade skincare brands that support our members with education, training, and resources to launch successfully. Whether you're looking to add your first line or strengthen your current offering, Fresh can help you connect with the right brand partners. So, if you're curious about how skincare could fit into your clinic, reach out to us and let us chat about how we can support you. Visit freshclinics.com to learn more.
And you touched on the self-directed learning that perhaps patients are doing themselves at home, and education is key in all spaces. But what about from a nurse perspective? They might be engaging with a skincare brand or looking into, what kind of products they want to stock. There could be dozens and dozens to choose from.
It is, isn't it?
And you mentioned that, a lot of skincare brands are happy to come and do treatments in clinic and educate you. In your experience, what do you think are key training and resources that healthcare professionals should be looking for when introducing a skincare range that's not going to, there's also cost to time as well. How much time should they be investing and what kind of training should they be looking for?
Good question, Loz. Look, what's really quite cool about a lot of the suppliers now is they do have e-learning for a lot of their products, and most of them have also got really good manuals, and so you can do your own learning about those ranges. But I would think if you're deciding about who you want to go with, there are a few things that you want to consider. And I think one of those is actually, this is just how I feel about it, but it's just also a little bit of a culture thing as well. If these people are going to kind of be your right hand men, your men and women, when you're using a brand, and so support as a business owner and as a nurse is really important. So meet who the trainer is, meet who the reps are. Is this a nice relationship? Am I really vibing with this person? That for me is step one. is I want to know, just about who they are as a company, who they actually are, like how they roll, 'cause
Vibe's
it's like
the key.
the vibe's the key.
Yeah.
Because like, you can be coming in here and coming and talking to my girls, like you need to be cool.
Yeah.
And so that's step one. And then step two, it's like, all right, now what have we got here, sis? Have we got something good here or is it garbage? And so let's try it. I want to use it for 4 weeks. I want a treatment. How's this going? And then you should already be starting to like tick a few boxes there, right? Okay, they're good people. They've got good support. They've got good resources. What's their e-learning like? What events do they do? What are the awards that they do? Have they been working with cosmetic injecting clinics before? What do they know about what you guys do? It's all looking at all of those different pieces. And what might work for me, it might not work for someone else, and vice versa. So it has to be about what, as a business owner, what you're trying to achieve, and you need to make sure that you're actually aligning with a company that is giving you that really good support that resonates for you.
Yeah.
And are there brand identity elements too? Like if I and my brand want to be very scientific,
Yes.
then I can align with something that really promotes that. If it's organics and all naturals and so on and so on, that's also a thing to uncover.
Those types of concepts are, if you start to look deeper into every skincare brand, they actually all have very different concepts to each other. And it's not a one-size-fits-all approach when it comes to looking at all the different brands. And in some of them, I've got 2 brands in my clinic at the moment, and one is very lipid rich. It's got beautiful oils and there's these beautiful textures, and my other brand has none of that. So they're very, very different to each other. And sometimes you can look at it all and be like, it's all the same. It's actually not. It's not all the same at all. You might have 10 vitamin Bs in front of you. They're not the same. They're actually very, very different, and they do different things, and they have different ingredients in them. And so I think that it depends on, again, exactly like you're saying, John. It's like, as a business, what's your concept? Do you want something quite very, very clinical, and that is like nowhere else, and that is, a little bit of a song and dance to get into it? I know Cryomed's got a beautiful range that they launched, which it's very bespoke, like they have like an AI analysis, and then it sends it away, and you get the results, and you get these gorgeous little tubes, and actually nice stuff. I tried some of that, and I was like, wow, okay, that stuff is beautiful, and that's going to fit a certain market. That is going to fit a certain injector, is going to make that work so beautifully with these customized serums that they have. Other places, that's not going to maybe work as well, because they're like, I just need to get her on a BNC, and just get her out here. And so like, my patients aren't going to want to fanny about with that. They're just going to want to get their stuff and go. So I think so. It's just understanding the concept of the brand, understanding the concept of your business, and then aligning that up. And just understanding it's
that's a thread that's connected through a lot of these conversations, is defining your value as a clinician, defining your concept as a clinic. How do you stand out? You've got to know that to be able to then make these downstream decisions around what skincare aligns with my values and beliefs 100%. For my clinic. I suppose the other question that is there hanging out there is the commerciality.
Yes.
How does that work in a clinic? How can a clinic make sure that the time commitment put into learning and selling repays through straight commercials on the product, and then also return business and satisfied customers and patients and so on?
That's right.
What's your experience there? What should we be looking for as sort of rules of thumb?
Look, I mean, I'm always looking for 100% markup, like a minimum, that's just, but most of them are. It's very rare to find something like that. And also, it's just depending on your budget as a business too. Like what's really cool about Fresh, and something, again, that I was working on, was making sure that some of the opening orders for the brands that were perfect for those cosmetic injectors just starting out were not big $14,000 opening orders. There's something that a business can get into and get it into their business, and with budget-friendly pricing, with good packages. So that's one part that you want to look at. I think if you're first stepping into this, having something quite, something that is very efficient and like quite compact is probably going to be the better way for you to get into this. Don't go and overwhelm yourself and by getting these brands that have got lots and lots of lines. If this is your first step into it, just start to get something in that is going to be really efficient and going to work really, really well, and you don't have to spend a massive budget on to get it in. And then just start making some recommendations. And then this product starts walking out the door. And then you're starting to get an extra 20, 30,000 coming to your business in a month just in product sales. And half of that is your profit. And that's just not also taking a massive amount of time out of your schedule, because you might be back to back with your injecting patients all day. Where are you going to start? You don't have time to also run another room of skin as well, but you can actually bring that extra chunk of revenue into your business with its minimal output. You might have to do a little bit of study just to get your hair around this range. Most of the brands that are on the Fresh platform, you can complete that training. I know with the skincare company, 2 hours.
Yeah.
Yeah.
2 hours they can spend with you to do that.
Yeah. And we have some amazing ranges. Also, honorary member of Fresh Always, Steph.
Alumni.
Yeah. And some of like the brands that you were a part of, bringing into, the Fresh community, you mentioned the skincare company. A lot of these guys also showcase what it means, like case studies of how many products you need to sell or what packages would work well alongside aesthetic treatments and how many would then make X amount of profit per month. And when you break it down, and I think that's really important for time poor clinics to actually really see that from their perspective. I think you've spoken about this throughout this entire conversation, but it is also bringing it back to what's in the best interest of the patient. And again, they're coming to you for an outcome, and you're just giving them you're elevating their results through introducing a skincare component that you can confidently know will complement what you're doing, which is awesome. Why do you think that clinics and clinicians should be really confidently speaking about skincare?
I've been working as a trainer in the skin space for a long time, and I love it. And so a lot of my work has been coaching women on how to do exactly this. And one of the things that we all do it, nurses do it, I see them do it too, beauty therapists, dermal therapists, we all do it. We all do suffer, I think, from an element of imposter syndrome, and we can also have our own barriers with, people can feel really guilty about recommending skincare. They can feel really guilty about, just saying the bill for what that patient owes them. Which is all your own sort of mental self-worth and lack of, and I grew up and my mum was like, man doesn't grow on trees, sis, and so you end up in that mindset sometimes that can be hard to break out of. And the way that I've remedied it is it's actually just been purely through the experience of seeing what happens when these things are not done properly, i.e. skin treatments are not done properly, and you're not doing it's science. Like it's not like a faith-based system, right? I can't do a microneedling on you and just hope it'll be okay. There's an actual process that's happening. So the way that you can really overcome that and gain that confidence is honestly through education and understanding what these things are doing. Because once you understand it and you learn it all, nobody can argue you out of it. No one's going to be able to sit there and be like, no, but my cream from the chemist is lovely. I don't need to have that. And it's like, I'm not saying it's not lovely. I'm just saying that it's not going to be enough for what I need to do. So it has to be as the practitioner, you must believe and be educated and understand that. Then you will be able to confidently recommend it. And just as a little tidbit, I heard one of my girls the other day, this is something like I have seen it for years. This happens for years. I had a patient that was at the desk, and I saw one of the patients just said I wanted to get an eye cream. And I see it happen all the time. And the therapist or the nurse or whoever it is will go, what one do you want? And I'm like, and I could hear it, and I'm like,
Instead of what problem are you trying to solve?
Ask her that. Yeah. This isn't a shop. Let's remember this.
Yeah.
I know it looks like it, but it's not a shop.
Yeah.
That's not the question. The question is, okay, so what are you wanting to do around the eyes? What's bothering you? What's bothering you around the eyes? And so I don't ever want someone to tell me what they want off there. We've got to switch that. Switch that up. You are the leader. You have to take control of the situation of that patient. Go, right, Charlie, okay, let's have a look. What do you, this is a bit crepey around here. So, okay, you need some peptides. Let's get you all some peptides and let's get that in. I'm going to give you this one here. This is perfect.
Oh, and again, that connects to all sorts of assessments and treatments that are done in the clinic, right? Someone comes in and says, I want my frown lines.
Yeah.
And instead of just delivering that, the question is then, what are you trying to achieve? What are you worried about?
Sure.
Yeah.
It's almost like you, even as a practitioner, as a nurse, as a doctor. Yeah. So if someone's saying that, and it's like you saying like, oh, okay, so which anti-wrinkle do you want me to use today?
Yeah.
Here's the menu. I've got all of them.
Yeah.
You know, how can someone make that decision? And it's exactly the same with skin. They don't know. And if they do know, no, they don't. And so you need to be the leader. And the only way you can get there is by being empowered, by being educated, by believing it, by using it. And then you're going to be able to confidently recommend.
So if there's a clinic out there listening at the moment and they don't have a skincare range, but they're curious because of all the great reasons that you've articulated, what do you think is what's the do's and don'ts of starting that journey, launching that, and beginning to realize their kind of skincare part of their clinic? What would you list there?
I might also add, if someone does have a skincare range and they are maybe not utilizing it and it is collecting dust on the shelf, like what would be the do's and don'ts of like even reassessing after that?
Yeah, that's a good point.
Yeah. I think it's when I would look at something like that, it's generally because there is a lack of support or there's been a lack of training. Because if you know it and you know what's going on here, that wouldn't be happening. So I think that, I mean, there's so many different diverse teams as well within this industry. We've got a lot of nurses and a lot of dermal therapists working together, a lot of nurses, a lot of beauty therapists working together. So there's definitely a lot of dynamic. And then you've got the nurses and they are on their own or in a team of nurses. So there's lots of different dynamics out there of what's happening. So if I went into a business, if I was working for one of the skincare brands like I was, and I saw stuff sitting there, my immediate response would be like, this is a training issue. Because number one, I only work for brands I like anyway. But, I knew I already loved it. I would be walking in there going, why aren't you guys loving it? Like we've lost something here. Like something's just disconnected. So every time I have been in that situation, it has just simply been a lack of training and support.
So if
they don't know what it is.
If there's someone listening to this and they walk into their clinic tomorrow and they look up at the shelf and they see all the skincare range and it's got dust all over it, and there's dust all around it, and if you move the thing, it's a circle of dust. Like what? So you reckon that person should call that organization and say, hey, I don't think I know enough about the product because it's not moving.
I need training.
Yeah.
I need support. I need to know, like because there's significant outlay sometimes with some of them, sometimes there's not others, but you want this moving. Number one, we want the best patient outcomes. That's always the first step. Number two, we're trying to run a business here. We've all got bills to pay, we've got staff to pay, we've got things to do. So we need to be bringing revenue. And if you've just got this dead asset sitting there, which is now turning into a great big liability, you need to examine why, what's happened here. And so what I would be doing is absolutely look within yourself and just look at that range and even have your own ponder. Why have I left that there? Do I not love it? Maybe I don't love it. I don't think I love it.
So you should be expecting more of it.
You should be 100%.
Yeah, you should be expecting that you're enthusiastic about it.
Listen, honestly, John, I'm a brand new clinic. I can't keep that product on the shelves.
Yeah.
I can't keep it on the shelves. I'm ordering every week. Like it's and I'm just, I can't even keep up with it. And so this is how it should be. This is how it should be.
Yeah.
And so if something else as well, when I was working, when I was with you guys last year and we had one of those, the growth accelerator, and I was sitting with a beautiful table of stunning wahine women, and they were, we were sort of setting goals, and everyone was looking at financial goals. And one of the gorgeous nurses there had put in what her 12-month financial goal was. And I remember looking at that and I was like, oh, no, sweet. I said, is that the year? She's like, yeah. I'm like, no, that needs to be a month. And she was like, what? And I was like, oh, my love, you can't sustain a business on that over a year. No, that needs to be what you're bringing in per month. She didn't believe me. And I think that, again, it's really looking at your business and understanding your business and actually setting these big goals. It is okay for you to be expecting your business to bringing in $100,000 a month, $200,000 a month. Even as a single practitioner, it is okay for you to have that goal and have that expectation. And your skincare can actually really help you do that. It can help you get there. You should be aiming for $10, $20, $30, $40,000 of skincare per month. And so if you're looking, you're like, geez, I only sold $500 worth of stuff. That's not working for you.
It's a health symptom of the clinic, right?
It is.
Because then the not only is the revenue that is directly attributable to the skincare there, but if you are the expert providing that skincare, guess what? That patient's coming back.
Yeah.
They're referring their friends.
Correct.
They're more satisfied. They're getting more other treatments. And because you're an expert in skincare and injectables, they're also trusting you for other things as well.
That's right.
Yeah.
That's right. My mum still rings me from New Zealand to get me to send her Mikey skincare, Face Off Skin. I've got a clinic with skincare in it. And she's like, oh, sis, you can't get me that much of some of Mikey's stuff, can you? Yeah. And I send it across the world for her.
I also think patients are walking in the door for results-driven outcomes, and that can encapsulate having a really good skincare brand. So when you were talking earlier where financial, there can be that financial barriers, maybe a financial barrier within the person selling the skincare, I think bring it back to that patient is there because they want to be and they're here for a result, and this is just going to complement what you are already doing. Let's get them away from retail skincare and, getting them onto something that you can also follow along with their journey.
I'm interested, and this is coming from a naive point of view, but do you get what you pay for? Right. And so what's the
Love that.
Is it always the case that more expensive is better? Or does it sort of cap out a little bit and then people are just paying for the brand and the prestige? What's your opinion on that? Or I guess at a retail level, what's don't even bother, that's not good enough, that's too cheap, versus that's way too expensive. What should people be thinking about?
When you're comparing retail products to professional home care, they are chalk and cheese. But people think that they might be similar because there are some key ingredients that get thrown around. So we know things like niacinamide, ascorbic acid, and anybody can have that. Anybody can buy a vat of that somewhere and put that in something. But the key differences between a professional skincare brand is what you'll notice, and I've noticed this with most of them, they've got much higher levels of purity of the actual cosmeceutical ingredients. So sometimes, yes, that is reflected in the price. It is a little bit more expensive, but it's a little bit more expensive because that is genuinely got 15% matrixyl in there, and that's why. But it's also got all of these other ingredients in it as well. The other thing with the professional skincare that it doesn't have is it doesn't have a lot of real nasty ingredients in there. So when you're looking at a professional range, they tend to, I've yet to come across one that has got known endocrine disruptors, that has got known irritants and known carcinogens. And it is appalling the amount of skincare that is sold in a retail space, and I'm talking any of it, supermarket, chemist, all of that has actually got a lot of these filler ingredients in them that we now know, and we've actually known for a very long time, are actually not healthy and they're not good for skin. But you really don't get that. I have not seen, especially the major players like the big skincare ranges, you don't see them having those nasty ingredients in them. They're just not there. So there are definitely layers to the pricing when it comes to professional skin as well. But I have seen very, very good, reasonably priced professional brands. More expensive doesn't necessarily mean better. It doesn't. But I see that more prevalent and worse in the retail space.
Okay.
You'll see like a $400 cream and look at the back and you're like, there's nothing in it.
Yeah.
But if you see a $400 cream that's in a clinic, mate, that thing will be jammed packed with the Fountain of Youth, and it's worth that $400, And that's why, because you've got to remember too, when you're doing advanced skin treatments, you're damaging skin. That's what it is. So you can't be, you're opening skin, you're creating channels, you're creating inflammation, you're creating edema, you're doing all these things. So you have to have a cream or a serum that's going to repair. That's half of the whole, that's the other side of the whole puzzle.
And perhaps what you were saying earlier around when you're deciding on what brand to bring in, it is also this other checklist. Okay, what's the cost to me? What's the cost to patients?
100%.
What's the vibe check of
Yep.
the company? What's the packaging? What's the alignment with values? So like that is one piece. But if you're feeling overwhelmed by there being so many, like weigh up all of the what's most important to you and bringing something on.
Look at the price point. And if you're sitting there with a clinic and you're thinking it's going to be better for me to get the $400 creams in, that's going to be the better one for me to get, but you actually have a different patient base, you're actually better getting in a more lower cost range and having higher volume sales through your business instead of trying to sell something that isn't going to actually connect with your database. Like if you've got patients that are coming and they're dropping, significant amount of money on to have treatments with you, they are going to gravitate more towards a beautiful, luxurious range that is a little bit more expensive, but it's just jam-packed with all of this beautifulness. Then that's going to fit with those clients.
Yeah.
But that's what I was talking about concept before, and knowing your client and knowing your customer and understanding what's going to fit.
Yeah.
And sometimes, and I hate to say it, but you might find the exact same range, but you don't like the packaging. Trust me, just get it. Because sometimes the packaging, it misses the mark, but what's in those bottles sometimes is magic. And so just suffer the packaging.
Also weighing up what other treatments are you off? Like what other treatments? Do you have a device? Are you doing skin needling? How does the skincare range you're offering complement that? Are you an injectable only business and what's going to be best for your patients that are seeing you? So a few things to weigh up. I think you've
And don't you want to be the best? Like I want to be not the best, but I want to be good at what I do. I want to make people happy. I want to make them feel confident. There's the most beautiful part of what we do, which is where, when I was working in clinic full time the last time, just before COVID, and that's why COVID gutted me so much, was just the safe space it was for the patients. Like the way they came in, I was the first person they would come and see when they had their heart broken. I was the first person they would come and see when they were experiencing grief. I was the first person. I found out about babies and pregnancies before husbands did.
Wow.
It is so special.
Privilege.
Some of the best friends of mine, it is a privilege. Yeah. The best friends of my life were patients of mine. And I love them so much. And that's because I nerd out about this stuff and I love this stuff. And I create these beautiful skin on people. And you see these women sashay through the door and they walk in, you're like, yeah, girl. And it's like, oh my gosh, I get to do that with these people. Like just be better, be the best, do it as much as you can to do the whole thing instead of just one tiny piece of it. Like be a legend.
Yeah, I love that.
So Steph, for anybody listening, if you could give them one action to take off the back of this conversation, I could list about 10, but what's the first thing that comes to mind to you if someone was to listen to this and walk away and implement something into their clinic around skincare? What would it be?
Oh God, looks like your brain dishes up 1,000 answers. There's a couple of different scenarios actually, Loz, because I know that there's actually a lot of nurses out there and I know that they want to bring this into their business, but it doesn't interest them. And I get it. Like I do, like I understand. So I found, since being a business owner and doing this a few times, as a business owner, I feel like there's two decisions that happen in every day. And one of those decisions is, do I spend the time and do this, or do I pay someone else to do it? It's basically the two decisions that I'm constantly facing every day with anything that I do. And so I think that the key takeaway is you need to decide which side of the fence you want to be on in this business. Do I want to be the one that's investing my time and is going to be the one doing this and driving this? Is that going to be me? Okay, yep, okay, it's going to be me. Right, I need to start trying some things. The other side is, I do really want this in my business. I don't want to do it. I don't have the time for this. I'm not interested. Get yourself a skin girl. Get yourself a skin girl.
That's a really good decision point, actually, because I was thinking about my takeaway, not to skip ahead, but one of my takeaways was you should be using and loving the skincare that you stock.
100%.
And if you reflect on yourself and you're like, I just don't care that much, then that's a really good decision point that you probably need a skin person to come in.
It's a red flag.
Yeah.
Don't do it.
Yeah.
Don't do it, because you're going to invest this money and it's going to sit there and it's not, it needs to be driven. You have to drive it.
Yeah.
And so it's just like an injector or something. God forbid you had an injector on you that didn't really like doing it.
Yeah.
Imagine, how you going, Joe? Oh, hate it all. Like, my,
Can't stand it.
Yeah.
Don't care.
Extra and double part. I do that, And so it's okay to get someone in. And how lovely is it? I'm loving being in a situation where I've moved into more mentorship, and now I'm sharing everything that I've learned over the years with two beautiful girls that want to do this and want to be in this. So be a mentor. And Mikey was my mentor, and he doesn't do, well, he does a little bit of skin, but just he was my mentor. And so you can do that. You can be an amazing injector. You can be bored to tears when it comes with skin, but that's okay. Be an awesome mentor and get in a skin legend and be a team. Build your team out and let someone else do it.
Yeah. So many good takeaways throughout this conversation, I think. And for me, like, my takeaway is like confidence is key, and, loving, you, like echoing what JD said around getting in something that you love.
Yeah.
I think passion is definitely a theme from this conversation. And if you're passionate about something, I think it's never going to feel like you're selling anything, because it's coming back to what you want for your patients and you love it too. So this has been a lot of fun to chat with you, Steph. And we love you and we love everything you're doing. Congratulations for opening your own business as well.
Thanks, Steph. Thanks for your time today.
Very welcome, team. Thanks for having me.